One of the most common questions pregnant women ask is, how do I know when I am in labor? The truth is that labor can start differently for different women. However, there are 3 key signs that can help you recognize when labor is beginning and when it may be time to contact your midwife or maternity unit.
Contractions are the most common sign of labor. A contraction happens when the muscles of the uterus tighten and then relax. These tightenings help the cervix open and gradually move the baby down through the birth canal. In early labor, also called the latent phase, contractions are usually irregular. They may happen 1 to 2 times every 10 minutes, or about 1 contraction every 5 minutes, and they usually last less than 40 seconds. You may notice that contractions come for a while and then stop completely. They can be uncomfortable, but most women still find them manageable. Many women cope well during early labor by taking paracetamol if appropriate, practicing breathing exercises, having a warm bath or shower, resting and staying hydrated. If your pregnancy has been low risk and you are planning a vaginal birth, it is usually best to stay at home during this phase. As labor progresses, contractions become stronger, longer, and more regular. In active labor, contractions usually occur 3 to 4 times every 10 minutes, or around 2 contractions every 5 minutes, and they often last between 40 and 60 seconds. Unlike early labor contractions, these contractions settle into a regular rhythm and do not stop. They gradually become more intense and continue to build over time. Regular, rhythmic contractions that are becoming stronger and closer together are one of the clearest signs that true labor has begun. The second sign is called spontaneous rupture of membranes, or SROM. Many people simply call it your waters breaking. When your waters break, it may happen in different ways. Some women experience a large gush of fluid that feels like they have suddenly passed urine. For others, it may be a slow trickle or small leaks into a sanitary pad. If you're unsure whether the fluid is urine or your waters, try smelling it. If it smells like urine, it is probably urine. If it does not smell like urine, it is more likely to be amniotic fluid, also known as your waters. It is normal for the waters to break in preparation for labor. Most women will go into labor naturally within 24 hours after their waters have broken. Whenever your waters break, you should inform your midwife or maternity unit. This does not necessarily mean you need to go to hospital straight away, but the maternity team would like to know and discuss the plan with you. There are a few important things you should look out for. If the water looks green, greenish-brown, or contains meconium, you should contact your midwife or maternity unit immediately. You should also seek advice if you notice blood in the fluid. These findings need prompt assessment by a healthcare professional. The third important sign is pressure in the pelvis or an urge to push. As labor progresses, and especially after the waters have broken, the baby's head often moves deeper into the pelvis. This can create a feeling of pressure low down in the pelvis. In early labor, mild pressure can be completely normal. It may simply feel like you need to pass urine more often. However, you should contact your midwife or maternity unit if the pressure becomes significant, especially if it comes with contractions. You should also seek advice if you feel a strong urge to push, you find yourself pushing involuntarily, or you feel that your body is pushing without your control. These can be signs that the baby is moving closer to being born. So, how do you know if you are in labor? Look out for these 3 key signs. First, regular contractions that become stronger and more frequent. Second, your waters breaking. And third, increasing pressure or an urge to push. Remember, the only way your midwife or doctor can confirm labor is by assessing you, and sometimes by performing a vaginal examination to check whether the cervix is opening. See other videos in this channel regarding vaginal examination. However, contractions, waters breaking, and pressure are all signs that you can monitor yourself at home. Knowing these signs can help you recognize when labor has started and when it is time to call your midwife or maternity unit. If you are ever unsure, trust your instincts and contact your maternity team for advice. They are there to support you. Know the signs, trust your body, call your midwife when needed. Subscribe and follow for more videos.